Hi, good afternoon. Thank you for being here. I'm Paul Carringer. We hear a lot about money, and we hear a lot about systems, and we hear a lot about different groups doing different things. In your view, what is it truly that we see as far as collaboration today across systems and driving the dollars into the system to make it more efficient and more effective? And what does it really need to be to get Ohio to where it should be, a leader and not a follower? What is that that's in the way of collaboration across the systems to make it efficient and effective?
Great. I think maybe we'll start with Greg. And I'm wondering if maybe you could share the New York State example, too, that we used as a part of the population health planning work.
Yeah, and what Amy's talking about is last fall, building on what Teresa was just talking about, what Teresa was describing is actually an effort in this community for folks to work together, develop an assessment together, and do improvement plans together. It's real leadership to be able to come together as a community and do that. Many places in the state don't do that. So every hospital has a separate assessment and plan. Every local health district has an assessment and plan. 123 health districts, 170 hospitals. We have 300 some assessments and plans.
Wait, and if I can interrupt, then there's United Ways that do plans, and there's alcohol, drug, and mental health boards that do plans, and it goes on and on. Lots of plans, lots of assessments, lots of implementation strategies.
So we went through an intensive process with HPIO facilitating at the end of the year last year to look at a few simple things we can do to help make that more straightforward. For example, instead of everybody being on a different schedule, let's just move to the same 3-year assessment and planning schedule. So now in each county, everybody is going to be doing an assessment at exactly the same time. Why would you pay for 14 separate community health assessments when you could combine your resources, do a community health assessment, and then base your plans on that? So we're going to have a bill later in the spring that formalizes that, but we think it'll be welcomed both by hospitals and by public health districts, just for the clarity it provides. So there are things like that where you can take your resources and just be more rational about how you use them to plan. The other thing I would say in terms of the organization, I think Ohio has moved to the front of the list of states that are seen as being effective in getting results with what they do with their money. For example, 4 years ago, Medicaid was growing in excess of 10% a year. We took that down to 4% in the first year and then 2% in the second year. From that more stable position then, the governor was able to make a decision to extend coverage to more Ohioans who happen to be the group with untreated mental illness, things that then lead to housing problems and other sorts of issues, because if you don't have stable access to health care, it causes other problems. Just like in reverse, if you don't have access to housing, it causes health care problems. So that idea of creating a capacity at the state level to be able to not break the budget, we're scheduled to go back to after we expanded the program, Medicaid program growth is below 2%. That is manageable within a state budget. So fiscal responsibility gives you an opportunity then to think about how to extend benefits and coverage to more people.
So I would, can I speak? So that was a great question. So there's a lot of resource, and obviously Director Moody, Greg, is trying to help us all think about how could we use our resources better. So again, health systems, just in case you don't know, get about 85, 90, or 95% of resources come through the medical care side. Maybe that's what you were wondering about. And 5% or less, sometimes we think it's about a penny on the dollar, is connected to both prevention and public health. Public health is very underfunded. But That being said, it really is ultimately about working together. So you asked about how could we work together. Sure, we would like a lot of cash. That would help. But just this morning, again, infant mortality is a great example. Again, our Ohio Better Birth Outcome group is led by, well, through Children's Hospital, but it's all of the health systems working together on clinical care issues. Just this morning, I hosted, along with Dr. Roberts, our Chief Medical Officer who's here today, a group of all of the CMOs of the health systems, their lead OBs, their lead infectious disease, and their lead communicators, all coming together. We have just formed the Columbus-Franklin County collaborative to respond to Zika. So again, we do this all the time. It came up recently. Our community is better served, honestly, from a public health standpoint, but really this was our chief medical officer who said we all want to be on the same page. So again, there is a will to not compete in cases that really, I believe, will improve the public's health.
All right, one